Everybody, thank you for watching this YouTube video on what a colonoscopy is. So a colonoscopy is a small little camera in which we use to look inside your colon, see if we can find any causes for your symptoms, and also look for precancerous polyps. Polyps are precancerous lesions that have the potential to go into colon cancer. And the reason we do a colonoscopy is to help remove those polyps. But polyps are not the only reason to perform a colonoscopy. We also do this procedure to evaluate for any bleeding, any diarrhea, any change in bowel habits, or any change in bowel caliber, and even abdominal pain. The benefit of doing a colonoscopy is that it allows us to take a look at the actual mucosa of the colon itself and to allow us to take biopsies. Now, just because you're having a colonoscopy does not necessarily mean that something is wrong with you. The benefit of a colonoscopy is that it allows us to look at the mucosa of the colon and also take some biopsies. In addition, it can give us good diagnostic evaluation to help us figure out what's going on with your symptoms. So what we do with a colonoscopy is that we give you a bowel prep the day before to help clean you out. The next day we bring you up here to the hospital and we give you medications through the IV to make you asleep so you don't remember anything, and most importantly, you don't feel anything. We'll use this small little camera and we'll take a look at your whole entire colon to see if we can find any cause for your symptoms to hopefully get that taken care of for you. The procedure itself takes about 20 or 30 minutes, but typically you have to take a full day off from work because of the anesthesia that we give you. There are some risks associated with the colonoscopy, and those risks include bleeding, infection, risks from the sedation that we give you to make you asleep, a very small risk of causing a tear in the colon that might need surgery, a very small risk of missing polyps or missing lesions, and a very small risk of not being able to finish the procedure. Those risks combined are only about 1%. And obviously your safety is my number one priority. I want to make sure I do things safely for you and cause you no harm. If there's any concern whatsoever during the procedure, I can easily back off and proceed with other tests. More often, patients do great. They end up having a good 30 to 45 minute nap, and before you know it, we're done with the procedure. After a colonoscopy, you may expect to feel some pain or some bloating, which should go away over the next couple of hours. If you notice any significant bleeding or any significant pain, be sure to call our office to get further recommendations. After the colonoscopy, we'll have a follow-up visit with myself to make sure that all of the results are reviewed and to answer any further questions that you may have. Thanks for watching this YouTube video on what it's like to have a colonoscopy. If you have any further questions or concerns, please feel free to call my office. You can visit my webpage where I have more information on GI topics. You can follow me on my YouTube channel, follow me on Twitter, or like us on our Facebook page. Thanks and take care.